In a country of 30 million people, your medical record still exists on paper. What is the reality behind digital health gap in Nepal?
The user not so much digitally literate. Most of our doctors, they are little bit digital. Most of the hospital, they use EMR just for the printing. Previously been explored in one of the government hospital. In 5 minutes, they will take care of around roughly 2 to 3 patients.
3 patients within a few minutes. It's ridiculous.
Did the same practice in private hospital. After the use of EMR, the doctor can see more patients.
It's not just a luxury game. It's a matter of safety. When is the government going to wake up?
They are doing, but not doing what they need to do.
Who are these people who are making these policy changes?
They don't know themselves that what it means to digitalize.
We need to change the way we think about healthcare in Nepal.
Fill the KYC in the computer and take the print form and again submit to the government officer. That's the digitalization concept in Nepal, sadly.
Mr. Pawan, I am about to walk out of this interview. आजकलको प्रिस्क्रिप्सनमा आधा राइटिङ त चिन्न गाह्रो हुन्छ इट्स द फार्मासिस्ट somehow they know how the doctor writes हरेक नेपाली सिटिजनमा यो क्वेसनै आउँदैन हस्पिटलमा जाँदा कि यहाँ मेडिकल रेकर्ड शेयरिङ किन भइरहेको छैन
जुन हस्पिटल गयो नि पैसै खान
This is a digital world. Problem isn't we don't have the system. The biggest obstacle here is doctors not wanting the change.
In Nepal, we don't provide such education or we don't make the doctor aware that there is EMR you need to use and it has the benefits.
My big thing is patient safety.
Patient safety, I think that's not being considered.
Few policymakers that are on the seat that do not think to this level because they could easily fly to somewhere and get their treatment. But that is not the case for most citizens in Nepal.
10 years, all the private hospital will be in the EMR side, still can't guarantee in the government side.
Especially the young medical doctors.
When they graduate, then they just follow the traditional method of writing in the paper.
And this is just the sad reality of Nepal. Imagine a 65-year-old in Kathmandu handing over a prescription. She's already on 3 other medications from a different doctor, but no one knows. Not the new doctor, not the pharmacist, not even her family, perhaps. This is medicine in Nepal in 2026. Welcome to Chatter on the Streets. In today's episode, we will be talking about electronic medical records here in Nepal. The question isn't we need it. The question is why. So today I'm joined by Mr. Pawan.
Yes.
He is a digital health specialist. He's had about 7 to 8 years of experience. And the irony is, I just met him yesterday, but he was so knowledgeable that I just couldn't wait to interview him. So today we're going to get deep into why in a country of 30 million people, your medical record still exists on paper or a printer. So what is the reality behind digital health gap in Nepal? Is this truly an obstacle, or is this because it's lack of political will, or is this bureaucracy, or is it truly technical?
Actually, it's all. Actually, it's political willingness, government willingness, bureaucracy. There is one thing, and there is technology barrier, and everything is there. Because I've been in the EMR implementation side in couple of government hospital and almost in Nepal. I have been implemented around 50 to 60 hospital, and what I found that the user or the Nepali citizen are not so much digitally literate. So it's hard for us to train them in the computer. And that's why also adoption in EMR side is getting low. And irony is that most of our doctors, they are a little bit digital.
At the stage where technology might be a little challenging, yes.
So that's why the doctor who are the key person in filling the EMR, they are a little bit hesitate and not adapting so much.
Okay.
And the other side from the government is that the government has introduced many plans and introduced many digital things like for the disease code, for the leprosy, TB. Some of the project of government is quite good, but they have not done the interoperable things. So that's why the EMR is limited only in the hospital premise, and it needs to be flourished in every hospital, every connected, but that has not been connected. That's why also there is lagging from the government initiations also.
So when I do a brief search or when I did some kind of research, right, it usually says, oh, there are like 5 or 6 or however many hospitals that have EMR. But what does that mean, that they have EMR? Can you explain that?
In Nepal, yes, EMR is what we think, like EMR should contain all the medical record, all the clinical vitals. Yes. There are many things in EMR. But what we found in EMR, like I'm also an EMR company, we represent our company as EMR. More than EMR, we are dealing with ERP side. like financial side.
What does ERP stand for?
Yeah, ERP means enterprise resource planning. It basically deal with the finance side like billing, accounting, inventory, pharmacy, stock things. So basically all over in Nepal, hospital are more inclined on that side. And recently EMR been introduced as the printing medium. Like some of the hospital has used the EMR quite good. But in other sector, most of the hospital, they use EMR just for the printing and typing and provide it to the patient, like the printing medium or like the Word file. That's why we are lacking on that side.
Earlier, you talked about with the older generation of doctors, they're not maybe technology is going to be a challenge. But if I were to play the devil's advocate, is it because in an hour, a doctor here can see maybe 10 patients, right? But if you integrate EMR, how many patients will they actually be able to see and generate revenue?
Previously been explored in one of the government hospital and we faced such. And the interesting part is in 5 minutes, they will take care of around roughly 2 to 3 patients. So that's, and we think that it's not possible. So we need to make some technology enhancement or technology change that make them easier. And we think that we did the same practice in the private hospital. And we found that after the use of EMR, the doctor can see already the vitals at the time of waiting. They know all the information. So chance of a patient seeing is increases. I mean, the doctor can see more patient.
Yeah, maybe not 10, but but still, at least we're you talk about one rural region to another. You give a prescription. It might be an antihypertensive, and someone else has prescribed them 3 other medications. There's no connection. So I think for me, it's very hard to understand. We are living in 2026, and there's so many adverse reactions that are coming off of just prescriptions because pharmacies don't communicate. It's not just a luxury, it's an urgency. It's for someone who practices medicine.
Yes.
So it's not a matter of I'm not comfortable doing this. It's a matter of safety. And so when is the government going to wake up? You mentioned ERP. For me, it's more of, are we prioritizing health?
Yes.
It is not ERP, it is the safety of patients that don't know how to advocate. Most Nepalis don't even think about EMRs. Go your doctor, thank you, doctor, ki garne. That's all it is, because they're either scared to ask questions or they have no idea how to ask questions. There's no advocacy. Exactly. And so for me, when I come here and I unfold this part of medicine here in Nepal, it's not frustrating. It's kind of like a monkey show for me. That's what it feels like. We're going around like finance. And why is it so hard to implement? From a government standpoint, law, privacy चाहिएला, billing होला, मान्छेको demographics हरू हुन्छ. But we're living in 2026.
Yes, definitely.
And this has been ongoing for 10 years maybe. अहिलेसम्म governmentले चाहिँ के deliver गर्यो त, in your opinion?
In my view, गभर्मेन्टले एक दुईवटा सेक्टरमा चाहिँ हाम्रो बाहिरको फन्डिङ भनौँ अथवा आफ्नै सहकार्यमा चाहिँ यो ट्युबरकुलोसिस अनि एचआइभी एड्स अनि एक दुईवटा डिजिजहरूमा चाहिँ राम्रो काम गर्नुभएको छ। त्यसमा चाहिँ डेटा राम्रो कलेक्ट भएको छ। त्यो सजिलो किन भयो भन्दाखेरि सिंगल सिस्टम, थोरै पेसेन्ट ट्र्याक गर्न सजिलो भयो। तर when it comes about implementing the whole hospital, whole patient, the first thing with the doctor and patient ratio is too low. So the doctor can't deal with the typing. They are not comfortable with the typing in the computer.
We're living in the age of AI.
Yes.
You can do text to voice.
Yes.
And it'll just extrapolate everything.
Yeah, recently most of the EMR companies have now advanced to the AI. So integrating the text to voice, even the OCR things, that thing is being popularized. And regarding the citizen of Nepal, what we did is we do the telemedicine. We did the telemedicine back in the COVID times. And most of the patient, they become reluctant. Even the doctor become reluctant in giving the telemedicine. What the doctor think is that unless I see the patient, I can't prescribe any medicine. From the patient side, until he sees the doctor face to face, he is not so much comfortable in getting the medication. And that barrier has been, when that barrier has been lifted, then one of the doctor who is doing the telemedicine told me that this is really nice technology. We can implement and we can easily do many things. So I don't find any difference. So that sort of technical hesitation, technical barrier need to be really minimized. And regarding the government, they are doing but not doing what they need to do. Maybe they are not too much technology friendly. They don't know themselves that what it means to digitalization. Also, we recently see that what the digitalization means. We need to fill the KYC in the computer and take the print form and again submit to the government officer. So that's the digitalization concept in Nepal, sadly.
Mr. Pawan, I am about to walk out of this interview. Just kidding. Just because who are these people who are making these policy changes, right? Kinamani, I think I keep going back to saying like it's an urgency. It's a matter of urgency. Okay? It's not, I'm not comfortable. We don't have the luxury to say we're not comfortable in this day and age. So there's so many ways we can help people who feel technologically challenged. But maybe some part of me wants to say, once it's out there, and it's interoperable, then you get to see what the doctor is actually thinking. And are they actually scared of what they're prescribing? Because then you're going to be held more accountable.
Yes.
Right? आजकलको prescription आदत है पढेको writing the चिन्न गाह्रो हुन्छ. It's the pharmacist, somehow they know how the doctor writes. Part of me thinks maybe that is one of the reasons why, like, are we our own problem as providers? किनभने providersहरूले नै यो माग्नुपर्ने कुरा हो, okay?
Exactly.
It's like government or provider, like, and again, I don't live here in Nepal, but I will be frequenting Nepal a lot just because this is home for me,
Yes.
and my family lives here. And as I challenge the medical system here in Nepal, this is a matter of urgent attention, at least. And so that's why I'm like asking all these questions. So I hope you don't mind me being a little assertive.
No.
So if you could, like, a 90-day implementation plan, where would you start changing things?
For me, 90 days implementation plan is quite less because there are many things to digitalize. First thing, we need to make aware and make compel to the doctor, really write in the computer. No matter, it will be late, it will be too much technical or too much pressurized to them, but we need to do that. We need to have every data in the in the EMR site itself. If we do implementation like that, then after that, what we can do, we can just do the interoperable thing, but that takes a little bit more time. In 90 days, first thing is make them habitual, make them compile to write on that EMR things and make use of that EMR, because the patient will come in follow-up, patient will have the vitals, the doctor can have the view, okay, I can have the advantage, even we have the capacity of doing the packs, LIS, everything will be integrated over there. And I think that's the main thing I should do, or if I can, I have to do that.
Okay, so I might start seeing you in hospitals, and we can start with CAMS because I know like CAMS is already integrated EMR. What does that look like for CAMS?
CAMS, they are doing really good. We also tested some voice to test over there also. It's quite fruitful, and they are quite good result also. In the CAMS perspective, when the patient came, all the medical records will already be there. So when the patient visit back to the doctor for the follow-up or anything, the doctor will see all the previous history, all the vitals, everything. And that's why their decision making and their way of giving the diagnosis or identifying the problem is really improved and really helpful, both the patient and for the doctor.
So we're just limited because this is within the system, but if CAMS EMR can be shared with anybody else, because we're not there yet, right?
Yes, no, not yet.
If the government mandates EMR, because when we look at the overall data, 30% adverse reactions, it's killing people, right? Because of something that we can avoid. And so if we made this mandatory, the senior doctors, is there a need for them to see, I don't know, 40, 50, 80 patients? I mean, we've got a surplus of doctors that graduate. Like, they need to also, have this camaraderie of, hey, these are our juniors and we need them to be able to practice and grow. Like, we need to change the way we think about healthcare in Nepal, okay? If I had to audit them, all the malpractice that might have gone on because you're seeing 3 patients within a few minutes, like, it's ridiculous. People are complex here with their medical issues. It just behooves me to even think that this is continuing in Nepal. In 2026, Bangladesh mate bhaisakyo, Rwanda ma bhaisakyo. Like, this is the digital world. We have AI and we have the funding.
So I think not only the government, not only the doctor, not only the EMR provider, should be on the same page. I mean, all should have contribute from their side. Like from the technology company like us, we need to make the introduce of AI and make them easier. We need to have the pain point. From the provider side, they need to really implement EMR and get benefit of it. And from the government side, they really need to either compel it or make it best thing is they need to act on the interoperable. Once the interoperability is in the picture,
Yeah.
then what happens is that in the PHC level, we call it a primary health center. If the patient has some taken care in the PHC level, primary health center, then that data can be synced to the provincial hospital. We call it bigger hospital. There might be some specialist, and with the use of technology like from telemedicine also, the specialist can provide the service in the PSC, or the patient if came in the provincial hospital, his history will already be synced in the PSC level, and the patient don't have to be travel a lot, or their history will already be there, and main thing is they don't have to repeat the test that is seen often in the Nepal. Like if I do some test in one hospital, then I need to repeat the same test in another.
The
And that's why there is a saying in the citizen like Nepali called it Jun hospital gyo ni paisai khana.
Exactly.
Exactly, that's why.
Yeah, the patients don't know how to question or how to like change this because मैले अघि भने जस्तै कि हरेक नेपाली सिटिजनमा यो क्वेसनै आउँदैन हस्पिटलमा जाँदा कि यहाँ मेडिकल रेकर्ड सेयरिङ किन भइरहेको छैन के बट वी आर इन 2026 भने जस्तै कि and this is a digital world and my big thing is patient safety.
Yes.
It's so simple kuraharu we need to start avoiding. And it's not because the doctors need the luxury of like, oh, I'm comfortable. It is not that matter. We don't have that luxury. Like your urgency, that's why I think what you've said so far. So if I've heard you accurately, the problem isn't we don't have the system. It is more of we're stuck at this ERP.
Yes.
And the biggest obstacle here is maybe the doctor's not wanting the change. The senior doctors maybe more so. And the other part would be, I don't know, just like the nuance of like embracing something new.
I'm not sure whether it's right or not, but MBBS student, we don't teach them how to use the EMR or health informatics concept, anything. We need to make them educate from the education.
That is
And
a
why
very good
EMR,
point, actually.
why EMR is successful in camps is that all the doctor has gone to abroad, they learned something, and they are comfortable to use the EMR.
Right.
But in Nepal, we don't provide such education, or we don't make the doctor aware that there is EMR you need to use and it has the benefits. We are not doing that also.
No, I think that is such a valid point.
Yes.
I should not even thought about that. Is our graduates, the future of Nepal, the future doctors of Nepal, this should be incorporated like abroad. Even kids own computers and they're getting more tech savvy.
Yes.
And this is the younger generation.
Yes, definitely. Yeah.
Right? Like, I mean, we wear designer stuff and we've got all these cars and everything, but our thinking is so backward still.
Yes.
And the government is like, it's not a will. I think it's more of the citizens that you took the oath to take care of.
Definitely need to do. And patient safety, I think that's not being considered. And
At
patient
all?
safety, yeah, not at all. Not even the cleaning side, not in the infection control wastage side, nothing.
Nothing
at all,
nothing.
actually.
Yeah. So this digital gap in Nepal is just widening, I think.
Yes, very widening actually.
Right, where we should be like trying to narrow this. And it's only because there are few policymakers that are on the seat that do not think to this level, because they could easily fly to somewhere and get their treatment, right? But that is not the case for most citizens in Nepal.
Luckily, I got one chance to meet with a couple of the health advocacy with the minister, a health minister. And at a time, what I find that they should have the control in the medicine, prescribed medicine. They should do control in the referral part. They should increase the insurance part. Or
So they know, like this.
they know everything.
Yeah, they know all
But
this.
they don't realize one thing is that if we adopt the technology at first, then all the data will be there. And with the data, they can get the fact, they can know where it's missing from the report, but they are not focusing on the technology side, unfortunately.
Yeah,
Even
so-
the doctor, they think only about their problem and they think that it will be solved from the paper. But I think without technology, it won't be solved easily.
Yeah, we need to broaden our minds.
Yes, definitely.
We definitely need to, because I think what I've heard from you is I don't think this is a technical issue.
No, not so much.
To a certain point, yeah, it's not. It is how we are thinking about
Yes.
technology here in Nepal. It's the mindset here
Yes,
that
mentality.
is draining and at the risk of people losing their lives.
Yes.
And we are medical providers who take the oath to take care of patients. And this is just the sad reality of Nepal.
Unfortunately, yes, the very sad reality. Recently, the government has taken initiation. I think they want to do something in digitalization aspect.
Okay.
But still, I think the digitalization in health is the far much.
It's not a priority
It's
yet.
not in the priority yet. I have not seen that priority. And the other thing is that we have many international organization and who has been contributing since a long time, but due to conflict of interest or due to some reason, that is not being effective how it should be handled.
In 10 years, do you think we're going to have the real EMR in Nepal? In 10 years.
Oh, okay. I think
Because I'm being generous. But will we have something in 10 years?
I guess it will be, but I will share you some interesting fact. Recently, I've been one of the hospital and I asked them, why don't you use EMR in the note taking in the nursing sector or the nursing side, like in the one of the ward? And he told me that we used to have 5 nurses, but due to the scarcity of the nurse, we are running the whole ward with 4 nurses. So they are already lagging in the human resource side.
Right, but I think this would make it more effective because what does paperwork look like in Nepal, right? Because when you see for nurses, they go document vitals, right?
Yes.
They do a physical exam. Do they have to document all of that? Or it's just, I'm sure the vitals, they let the doctor know.
Yeah.
But are they documenting their physical exam or the medications that they gave?
Unfortunately, most of the things are done by the nurse. So when we introduced EMR in Nepal, what we do is that we empower the nurse. Because we've seen that rather than the doctor, if the nurse use, then all the medical record will be over there. So we promote the nurse, unfortunately.
Exactly. You know, when the initial point of contact is the nurse, right? And so when you say, hey, like what brings you here today? What are some of your past medical history? What medications are you on? It's already in the data.
Yes.
I know. And then the doctor sees, and the next thing you know is just voice to text. Can we just train that? And it's there. And especially within just an entity like a teaching bonum, beer hospital bonum, at least within their own system, they know. I know. त्यहाँबाट नै सुरु पनि गरे भइहाल्यो नि. It's so simple. लेख्नु त परेन नि, बोले भइहाल्यो नि.
हामीले त्यो प्रयोग गर्दै पनि छौँ. अब भोइस टु टेक्स्टमा चाहिँ यहाँ अलिकति प्रब्लम भनेको चाहिँ नेपालीको उसमा त्यो पनि ओभरकम भइसकेको छ धेरै ठाउँमा. अरू टेक्नोलोजीहरू पनि आएको छ, एआईहरू पनि इन्ट्रोड्युस भएको छ. तर मेन कुरा भनेको चाहिँ अब इएमआर कसरी चलाउने, यसको युज के हुन्छ गरिदिने पायो भने चाहिँ अनि 10 इयर्समा आई थिङ्क इन 10 इयर्स all the private hospital will be in the EMR side because I have seen that EMR things or they are willing to do use the EMR and they want to keep the record of the patient, but I'm not sure in the government. I think I still can't guarantee in the government side.
So I'm like, duita thama khutta teknu sa basically.
Yes.
So it's like you don't want to let go of your what you've been doing in the past, and you're sort of like just trying to tiptoe into like the new world.
Yes.
And this is not sustainable. I don't think so.
No.
Kinwani, do you think Nepal can just continue being this way? Part of me says maybe, but with the new generations and as people want to come from abroad, like our NRN population is huge, and you know our parents are getting older here, right? So definitely. I am concerned about the safety of my parents, right? Like and this is why this is a matter of urgency for me. So yes. I hope everybody starts thinking this way, like especially the young medical doctors, that we need this. We need to be trained, like you said it so well. Like this should be introduced at that level, the MBBS level. Yes. And then you start getting comfortable and then you're dictating. We can dictate our notes too.
Yeah, definitely. They can do easily, but that's why they are not being tech savvy, or we have not introduced any course and we have not made them familiar with EMR anywhere. Yeah. So when they graduate, then they just follow the traditional method of writing in the paper.
So that's kind of where it is. Okay. So next time I interview, I guess we'll be talking about the same thing.
Sure. No,
I mean, like, I hope to witness some progress from the time, like, where we're going to leave it. Because as of today, we have a namesake EMR.
Yes.
Especially in the healthcare system. I'm not talking about in other aspects of, you know, digitalization in Nepal. I'm talking more specifically for healthcare. It's a namesake EMR.
Yes.
That is costing the lives of Nepalis because they are completely clueless as to why, you know, or clueless about the significance of EMR. And it's just the way it's been.
Yeah, definitely. I think that need to be changed, and I think we can change together with the stakeholder. Like from the doctor, government, everyone. Everyone should be aware of that.
Yeah, I think this needs to become mandatory. Like, that's what I'm thinking. It should be mandatory. Even if we haven't reached the stage of making it or interoperable, this should be mandatory even just within your own system.
Yes, definitely.
That way you have like sharing of notes, you know what's going on, right?
Yes.
I think so at least we can start there. And so
Yes.
that will be my plea to the citizens of Nepal to, even when you see a doctor, hey, like, why are you using paper? maybe the patients should start saying that. Kagisma kina lekheko मेरो medical record. Like, why don't you have it on, you know,
Computer
on the
application.
computer? Yeah. किन miss होला, मैले सधैँ कागज ल्याउँदिन होला. Not everybody knows. I mean, look at our population here, like our literacy rate here. कतिजना बुढाबुढीहरूको सबैजनाको छोराछोरी आएर लगिराख्दैन नि त, right? Like you carry एउटा ठाउँमा एउटा prescription हुन्छ, अर्को ठाउँमा 5वटा हुन्छ. The pill burden, testingहरूको burden, it's just like, it's endless. It's endless.
They need to do the same test over and over after visiting the different hospital also, because we don't have any sort of medical record and they can't carry or
त्यही भएर अब भन्न सक्दैन है मैले भर्खरै गरे हो. अब younger generationले त भन्ला, तर त्यही पनि. तर I think a lot of people are also just going abroad to get treated more than like stay in Nepal.
Yes. Yeah.
Mr. Pawan, I'm going to take a deep breath, but I am so thankful for your time because it at least helps me understand where we stand, the reality of EMR in Nepal. And like I've said it again and again, it is not a luxury, it's an urgency. And so I'm hoping to all the listeners, to all the people watching Chatter on the Streets, that you will take this as a matter of urgency, that you are going to embrace the change that is much needed. We need to go from like paper to digital health because we care for the safety of our people the most. As of 2022, only a few hospitals in a country of 30 million have integrated electronic medical records. And even where EMRs exist, they're barely EMRs. In Nepal, we call it an EMR, but it's just a printer. Doctors type, print, and hand over paper. History, allergies, and prescriptions, still invisible. The cost is real. Drug interactions cause 6 to 30% of all adverse drug events. In Nepal, antimicrobials lead, followed by antihypertensives and NSAIDs. The exact medications is a real EMR would flag in seconds. Then there's the bigger gap integration. A patient treated in Jumla can't have their records seen in Chapa. Every hospital is an island. The government has talked about connecting these systems for years. Nothing moves. And it's only about safety. A truly integrated EMR cuts insurance fraud, speeds approvals, and saves the system money. It saves lives. Nepal can't afford another decade of paper. Every undocumented prescription is a gamble. Every silo is a life on the line. The technology exists. The strategy exists. What's missing is urgency. So thank you for watching Chatter on the Streets.
Thank you.
Namaste.
Thank you.
Namaste.